Hey there, ultrasound peeps, how's it going? Today let's go over the lower extremity venous duplex protocol. As with all my other protocol videos, everywhere is a little different. So these are the images I take, so this is how I do it. Depending on where you go, you're gonna might have a slightly different protocol. But these, if you take these images, you'll be right as rain. Now I begin with the IVC. Here you can see IVC and a bifurcation into right and left common iliac veins. This isn't a neonate, so if you're going to do an adult, you're not going to be able to see this image. The only way you get any really good bifurcation images in an adult is if they're skinny or fair. But if you're doing neonates or very small babies and or preemies, you can consistently get views like this. Now, other institutions may not begin in the IVC. They may begin in the common femoral vein and go down to the popliteal vein. Some places go down further. So just keep that in mind. So I begin with the IVC in sagittal. No color, then I add color, then color Doppler and spectral Doppler. I don't augment for the abdominal vessels. Once I'm done with that, I go transverse on the IVC. You see the IVC in the aorta and transverse, usually in front of the vertebral bodies. Then I put color Doppler, and then I'm done with that. After that, I go into the bifurcation of the IVC. The bifurcation of the IVC is not as easy to get as the aortic bifurcation, so you can just move on to the common iliacs. So I'll begin with the right common iliac first. Take a sagittal image with no color, then a sagittal image with color Doppler, then a sagittal image with color Doppler and spectral Doppler. And usually at the common iliac vein, you can see the beginnings of the bifurcation to external and internal iliac vein. Now, when I'm doing the abdominal vessels, if the patient's a normal size, I'll do it with a curved probe. But if the patient's a baby, a neonate, and or skinny, I'll use a linear probe, a 9L, throughout the entire exam. So then we'll move on to the external iliac vein in sagittal grayscale, sagittal with color Doppler, and then sagittal with color Doppler and spectral Doppler. Once you're done there, you can go down to the inguinal region and begin in the common femoral vein. So beginning with the common femoral vein, I will begin to compress. So your first image of the common femoral vein will be in transverse, dual screen, one showing the vessels open and one showing the vessel compressed. Then go sagittal grayscale with color, and then lastly sagittal grayscale with color and spectral Doppler, and also an augmentation. You can perform a distal augmentation by pressing down on the thigh or calf distal to where you are, and you'll see an increase in blood flow, just like the pump of a heart. Once I'm done with the common femoral vein, I want to pay attention to the saphenofemoral junction. Take a grayscale image, color image, and color image with Doppler, with spectral Doppler and augmentation. Then I'll move on to the superficial femoral vein. Now there's been a consensus change where they want to say instead of superficial femoral vein, they want to just call it the femoral vein. So to not confuse somebody thinking that they have a superficial vein thrombosis or as opposed to a DVT, which the superficial vein is. However, everybody still calls it superficial femoral vein. It's just the way it is. So if I'm saying superficial femoral vein, I'm talking about the femoral vein. So beginning with the superficial femoral vein in proximal, you'll take your dual screen, transverse, grayscale, with and without compression. Then go sagittal, grayscale, sagittal color Doppler, and then sagittal color Doppler with spectral Doppler, and then augmentation. You're going to want to progress every 2 centimeters and continue. So then you go to the superficial femoral vein mid, perform the same images, transverse, dual with compression, sagittal without color, sagittal with color, and then finally color Doppler and spectral Doppler with an augmentation. You want to repeat that for the distal superficial femoral vein. And once you're done with the distal superficial femoral vein, you want to move on to the popliteal fossa behind the knee, and you'll be getting the popliteal vein. Again, same thing, transverse image with and without compression. Then a sagittal grayscale image, followed by an image with color Doppler. And then lastly, an image with color Doppler and spectral Doppler and an augmentation. Once you're done with the popliteal vein, you move down a little further and you want to try to find the tibial peroneal trunk, which is the beginnings of the trifurcation of the popliteal vein. So the popliteal vein is going to pretty much bifurcate or trifurcate, but the first thing is a bifurcation, which will be the tibial peroneal trunk closer to the transducer and then the anterior tibial vein. The tibial peroneal trunk will then bifurcate into posterior tibial vein and peroneal vein, which is also the fibular vein. Now this image is a little difficult to get. You might not be able to get it on everybody. So just give it a try. Try to practice it. You want to go medial on the upper calf, lower popliteal fossa region. Try to take those images. Sometimes you can only see it with color Doppler. If you're having trouble with the tibial peroneal trunk, you could always just move down to the calf and start getting the posterior tibial vein and the peroneal vein from the medial calf. And you could also get the anterior tibial vein, anterior and lateral to the tibia. Or you could also follow the dorsalis pedis and move your way up. So these vessels should be paired vessels. So you'll see one artery flanked by two veins. So the posterior tibial artery will be flanked by two posterior tibial veins. So you want to take some transverse images without color, add some, do some compression images as well. Put color Doppler. Go in sagittal, put color Doppler, spectral Doppler, and then distal augmentation. And you want to repeat that for the anterior tibial vein and the peroneal vein. Now, you might work at a place where you don't have to go that far down and you just finish your exam at the popliteal vein. In some other places, they might want you to scan the soleal and gastrocnemius veins. So every place is going to be different. And obviously, the patient might have indications to scan further down. So if they're having calf pain, you might want to look at the calf veins to see if there's any thrombus there. And with that, that's pretty much one side. You just want to repeat the exact same thing on the contralateral side. The left side is going to be a mirror image of the right side from the common iliac vein all the way to one side. And that's it. You're pretty much done. So I hope you guys enjoyed this quick one. I try to make it as quick as possible, but there's a lot of information to cover. So feel free to leave a comment, click the notification bell, subscribe, and like the video up. All right? Thank you. Bye.